Am I supposed to do something?
No, I
Oh,
think,
okay.
yes, we are officially live. Hi, everyone. I'm Taylor Plary. Thank you so much for joining us for today's Facebook Live with Dr. Judson Brandeis. We are so happy to have him here discussing supplements for ED and testosterone. So just a few announcements as more providers log on. We go live every single week on this provider page. If you're watching this, you probably know that this provider page hosts our Facebook Live sessions, and they're always pinned to the top of the page. If you want to find past Facebook Lives, many of them with Dr. Brandeis, you could go to the topic section, and within the topic section, there's a Facebook Live topic. You could find all of our past videos there, as well as in your Gainswave portal. I also want to remind you about some exciting features of being a Gainswave provider. Our virtual practice growth workshop is November 19th through 20th. And in this 2-day mastery workshop, you will work closely with our team of experts to gain valuable training and insights that you can implement immediately to accelerate the growth of your practice. I also see a lot of providers continuing to upload their medical questions to this page. Feel free to continue to do this, answer each other's questions. We love this feature of the group that we're all able to talk to each other and talk to you. And without further ado, just give us a thumbs up, a like button at the bottom of this video, and I will hand it over to Dr. Judson Brandeis. Hi, Dr. Brandeis.
Hey, Taylor, how are you?
I'm great, thank you. We're really excited to hear about these supplements and about testosterone.
Fantastic. Yeah, I'm happy to be here, and thanks for having me. And while people are straggling in, I thought maybe I would talk a little bit about my experience. I participated in the Pfizer vaccine trial as patient number 28,132.
Wow.
And so, yeah, so it was a friend of mine is one of the sites, runs one of the sites that is administering the trial. So I was super happy that I found out that it was 90% effective. And I personally believe that I got the vaccine. One, because my deltoid was pretty sore after receiving it. And typically it wouldn't be that way if I just got salt water. And second of all, I didn't really get flu-like symptoms. Typically, like if you get the flu vaccine, sometimes you'll get flu-like symptoms. I got some strange symptoms like rectal urgency, like when I had to go to the bathroom, I had to go really quickly. And for a while, I was like, maybe I should get on a gluten diet or do something about that. And then I talked to a friend of mine who was in the trial, but he was about 3 or 4 weeks ahead of me. And he said he had the exact same symptoms. So I must have gotten the vaccine because, that's an unusual symptom that eventually went. Yeah. Yeah. It went away, after 4 or 5 days. So I kind of had to explain that to my wife. Like, why are you running to the bathroom? I'm like, well, Horowitz got the same thing. So I think we both got the vaccine. And he actually got his antibody titer. You're not supposed to know if you got the vaccine or not, because if you knew, it would change your behavior.
Mm-hmm.
So they drew an antibody titer on me, but they won't tell me the results until the end of the study, which is like 2 years from now. But it's an mRNA vaccine, it's the first time anyone's ever used an mRNA vaccine. So for those of you who don't know exactly what that is, usually you take like either a piece of the virus or a crushed up virus or a dead virus, and then inject it, and then you generate antibodies. And this one, for the first time, what they do is they take a piece of messenger RNA and they inject it into the muscle, and the messenger RNA is integrated into the muscle cells, and then your muscle cells actually produce a piece of the spike of the coronavirus. And then your immune system recognizes the piece of the spike as foreign, and it attacks the piece of the spike. And then that will give you antibodies that will help you recognize coronavirus when your immune system sees it, cover it with with antibodies so that your immune system can recognize it as foreign and gobble up the virus.
That is fascinating. Thank you so much for sharing that with us. Any providers who have follow-up questions for Dr. Brandeis on that, please just post them in the comment section. That's so
Yeah,
great.
and so it's it's a 2 injections separated by 2 weeks. And the thing that they're really not focusing on, which they really should be focusing on, is so the Johnson & Johnson virus is a one-shot virus that you can store at room temperature, but no one knows if that that vaccine works. The Pfizer vaccine requires negative 80-degree freezers. So like the stuff that you are supposed to store like stem cells in, the negative 80-degree freezers. And the thing is, I don't think that there are that many negative 80-degree freezers just hanging out to vaccinate a population of 333 million.
Right.
And so instead of building ventilators at this point, we should also, or in addition to building ventilators, we should be, if we were taking the coronavirus response seriously, we would be building negative 80-degree freezers and, you know, putting them at Costco and Walmart and Target and all these places where people could go to get these vaccines. But the scary thing is in this country that 50% of people are considering not getting the vaccine. So I sent something out to my patients through MailChimp, basically saying, you know, telling them about my personal experience. I think it's comforting when they see that their physician, who presumably knows more than they do, is actually taking the quote risk of getting the vaccine and just sharing my experience.
I definitely feel that way.
So,
Having
you know,
experience. So,
yeah, if it's good enough for me, it's got to be good enough for everyone else.
right. Well,
So,
thank you so much for sharing.
awesome. So let's talk a little bit about supplements for erectile dysfunction and for testosterone. You know, it's a subject that's sort of near and dear to my heart. You know, a lot of you guys know that I started Affirm Science. And the reason I started Affirm Science really was my knowledge of nitric oxide, which I got from my days at UCLA. So when I was at UCLA, there was a scientist named Lou Ignarro, and Lou Ignarro. Well, I'll move back a little bit. So in the urology department, there was one of my attendings was a guy named Jake Rafer. And Jake was a good surgeon. He was in the sexual medicine field, but also he's a very good scientist. And he actually ran a biochemistry lab in the Department of Urology doing basic biochemistry work on erectile dysfunction. And he and his PhD were chasing down a molecule called endothelial-derived relaxation factor, EDRF. And they found that this EDRF was responsible for dilating blood vessels, but they couldn't really characterize EDRF because it was a molecule that appeared and then just disappeared. And so one day, Jake Rafer was riding the freight elevator up to his lab, and he was riding with another doctor, Dr. Lou Ignarro, and they started talking. And Lou Ignarro was going to the vascular physiology lab. He was a professor of physiology at UCLA. And they're like, oh, you know, what do you do? What do you do? So on and so forth. And so they started talking about what they were doing. And the conversation spilled over into Dr. Ignarro's lab, and Dr. Ignarro invited Dr. Rafer into his lab. And Dr. Rafer was talking about this molecule, EDRF, that dilated blood vessels. And Ignarro said, well, you know, that sounds really a lot like nitric oxide, which is what we're investigating for vasodilation. And so the two of them collaborated. And in 1998, Lou Ignarro won the Nobel Prize for discovering nitric oxide as a second messenger. And then the two of them published a paper in the New England Journal of Medicine on the mechanism of action of sildenafil. And so this was all going on, you know, when I was at UCLA, and you know, obviously it's a big deal when your professor discovers the mechanism of action of Viagra and publishes the paper. And one of my good friends, who was one of the senior residents, actually did most of the research, should have been the first author on that New England Journal of Medicine paper. And so anyway, I was super familiar with that story. And when I started doing Gainswave, Gainswave takes care of the pipes, right? But in order to get an erection, you need the signal and the pipes, right? And the signal for dilating blood vessels in all mammals, in men, in women, in penises, in biceps, in the brain. Nitric oxide, actually, the brain is the organ with the highest concentration of nitric oxide of any organ in the body. The brain is highly dependent on nitric oxide. And in cats and dogs and giraffes and rhinoceroses is nitric oxide. Nitric oxide is really ubiquitous. And it is, the purpose of it is to dilate blood vessels. And so when I went to Florida to do my Gainswave training almost 2.5, 3 years ago, on the plane back, I was thinking about, what else can we do to help these men with erectile dysfunction? And nitric oxide was clearly the answer. And so, but nitric oxide comes in all different forms and ways to replace it. And so what I thought I'd do is start with a bunch of slides about nitric oxide, because clearly that's the most important supplement for the treatment of erectile dysfunction. And then I'll go through some of the different forms of the ways that you can get nitric oxide. And then I'll talk about maybe some testosterone supplements. And there's so much bad marketing out there in the sexual supplement space because of the nature of sexuality and the embarrassment and so on and so forth that surrounds it, that we all know, that I'll talk about what works, and then also, more importantly, what doesn't work. Does that sound good, Taylor?
Yes, absolutely. Thank
you.
And
is my audio coming through okay?
Perfectly.
Okay, great. All right. So men's sexual health supplements, what works? L-citrulline, beet extract, ginseng, muripuama, DHEA, Tongkat Ali, and ashwagandha. And when I say what works, means what actually has research out there that will show that it works, how much it works. And what does not work means that it's not that it absolutely doesn't work, but it really hasn't been proven. So yohimbine, tribulus, fenugreek, ginkgo biloba, velvet antler, and also horny goatweed. I didn't put on that list, but I talk a little bit about horny goatweed. So, okay, so it's really essential if you're treating erectile dysfunction that you understand this slide. This is like the slide that you really should totally commit to memory. Okay, so in an erection, sexual stimulation. Do I have a pointer? Can you guys see that arrow?
We can see your mouse, yes.
Yeah, mouse. Okay, all right, good. Sexual stimulation. I won't show you the sexual stimulation, just take my word for it. This is not a rated X slideshow, but a rated PG. Of the cavernous nerves, so the nerves in your penis, result in the release of nitric oxide. Okay, and that nitric oxide goes to the smooth muscle cells of the blood vessel, and to and there's also nitric oxide released by the endothelium. So, okay, so there's nNOS and there's eNOS. So eNOS comes from the endothelial cell, the endothelial nitric oxide synthase, and the nNOS comes from the nerve nitric oxide synthase, okay? And the nNOS is kind of like the flint, when you light a fire, right? But most of the nitric oxide is really going to come from your endothelium. So the nNOS and the nitric oxide from the nerve kind of lights the fire, and the endothelial cells are what keeps the flame going. Okay. And so what it does is nitric oxide converts GTP into cyclic GMP. So the nitric oxide activates guanylate cyclase, and anything with an ASE is an enzyme. So it converts GTP into cyclic GMP. And this yellow thing should be circling cyclic GMP. So cyclic GMP is really the key molecule. I actually explain this to my patients, and using cyclic GMP, it's much more understandable. Okay, so cyclic GMP then initiates a series of reactions that influence calcium, which then results in smooth muscle relaxation, right? So you relax the smooth muscle of the sinusoids, open up the vascular spaces, and then also dilate blood vessels to open up blood vessels. Okay, but the blood vessels can't stay open forever. So you have a separate series of enzymes called the PDE enzymes, the phosphodiesterase enzymes. And so PDE is all throughout the body, but unlike nitric oxide is nitric oxide. Doesn't matter whether you're in the tip of the head or the toe. Nitric oxide is nitric oxide, okay? But PDE is different. So you have PDE 1 and 2 in the brain, PDE 6 in the retina, PDE 4 in the lungs. In the penis, it's primarily PDE 5. And so that's why something like Viagra or Cialis or the other PDE 5 inhibitors work effectively, because it blocks the breakdown of cyclic GMP into 5' GMP, which closes up blood vessels, right? So the more cGMP that you have, the more the blood vessels stay open. Okay, so this is really like, if you're going to remember one thing from this talk, and if you're going to teach your patients one thing about nitric oxide and about PDE5 inhibitors, it's this slide. You really have to understand this if you're in the field that we're all in. Okay. And so what happens as you get older? So I sit down with my patients and I talk to them about aging. And I say, age is like candles on a birthday cake, right? But I have a patient who on his 80th birthday did 1,100 push-ups in 1 hour. He broke Jack LaLanne's record for push-ups in 1 hour for someone who's over the age of 80, okay? And so clearly physiologically, he's not 80. And so there are certain physiologic processes that wind down as you age. And one of those things that winds down is the level of nitric oxide. And it's not like you fall off a cliff, like, when women go through menopause. It's more of a gradual process with like the androgen decline of the aging male, right? ADAM. And so if you're 50, I'm 53, so I'm right here. And, if I had a really crappy diet and I was totally inactive, I would only have 15% of my nitric oxide levels. Whereas, if I'm super healthy and eating really well, which unfortunately I don't do as well as I should, you would be up around 75. And if you're the average American, you're somewhere around 40%. So what does that actually mean? Okay. So think of it like a dimmer switch on a light, right? So at 100%, you can do anything. You can do surgery, you can do speed reading, you can do anything you want. When the light's down to 50%, you might not be able to do surgery or speed reading, but you could pretty much do what you need to do on a daily basis. But, you're not going to be super active. And if your levels are down around 15%, 20%, you're going to be able to do even less. But just to use the analogy of a light, you're still going to be able to walk around a room without knocking into a table. And so people assume as you age that you're going to be able to do less, but the reason that you can do less are because your levels of testosterone are declining, your levels of nitric oxide are declining. And the beautiful thing is these things are relatively easy to replace. So, and nitric oxide maintains vascular elasticity and prevents platelet aggregation. So it prevents platelets from bunching up and blocking blood vessels, and it maintains the elasticity or the stretchiness of blood vessels. Okay, and why is that important? Well, everything, you know, that my kids say, Dad, everything goes better with bacon. All right. But in this case, everything goes better with blood flow, right? So I have patients who are diabetics and I put them on Affirm and they tell me that they have to adjust the amount of insulin that they use down because their blood sugars are in better control. It's not anything magical that nitric oxide does with blood sugar, but it's improved circulation. I have patients that have neuropathy of their feet, and they tell me that they have less neuropathic pain. It's not because nitric oxide is a pain medication. It's because they get better blood supply to the foot, so they have less ischemia of the foot, and so they have less pain. And so everything goes better with blood flow. Okay, so this is a really complicated slide, but I'll walk you through it. It's actually not so complicated. Okay, so a lot of supplements contain arginine, and it's confusing because arginine is the nitric oxide donor, and we'll get to that in just a second. Okay, but just go through this with me. Arginine, when you ingest it in the intestines, right? These are enterocytes, so they're cells that line the intestine. Arginine gets converted into another enzyme called ornithine, right? And so ornithine, I honestly don't know what the function of ornithine is, but it's not a nitric oxide donor, okay? And the arginine that does make it into the portal circulation, so remember portal is liver, the arginine gets put into the urea cycle and it's made into either urea or ornithine, and it drops your blood pressure. So just taking pure arginine, first of all, a good portion of it's not going to get through the intestine. And then if it does get through the intestine, it's going to get metabolized in the liver. Okay. And now this is citrulline, and citrulline, it comes from watermelon. And if you look up here, it's kind of blocked here for me, but 3 grams of L-citrulline is the minimum effective dose of L-citrulline. So that, in terms of Affirm, is 4 Affirm tablets. So each a tablet of Affirm has 750 milligrams of citrulline, but it's got beet, it's got ginseng, it's got Muir, so it's got 900 milligrams of active ingredients. So 3 to 4 tablets of L-citrulline really is the minimum effective dose. And 10 grams of L-citrulline is the maximum effective dose. But what the equivalent of that is watermelon. So you have to eat between, there's something blocking it, but I think it's 1.5 kilograms, which is about 4 pounds of watermelon, fresh watermelon, a day to get the amount of citrulline that you need. And I really like watermelon. And I probably would eat 4 pounds a day, but it's hard a lot of times to get fresh watermelon. And with the amount of sugar that watermelon has, I'd probably end up with diabetes. So I think a better alternative is to take a nitric oxide booster like Affirm. And, you know, we start patients on 2 tablets twice a day, which is the minimum effective dose. Okay, so, and then citrulline, right? So citrulline from watermelon or Affirm cruises right through the enterocytes into the portal circulation, through the portal circulation, through the liver, and then out into the bloodstream. So, you know, I'm a very visual person, and the analogy that I can think of is when I was younger, you know, back in the day, I would go out clubbing, and I would be on this long line in the clubs, and then there would be some highly attractive young women, and they would just go bypass the entire line. They would wink at the doorman, and the doorman would let them right in. So basically, like a guy like myself standing in line at the club is like arginine, and then a young, attractive young lady like Taylor, who totally skips the line and zips right into the club, more is like citrulline. Does that make sense, Taylor?
Yes, thank you.
All right, perfect. All right. So, okay, so once citrulline is in the bloodstream, it's got to turn into arginine. Okay, and it does that in the kidney, and I have a better slide of that in a second. And then once it's in arginine, then it goes into the bloodstream where it can do its work. So just to, well, I think we did enough on that slide. Okay, so, but, oh, all right, so really exciting stuff about nitric oxide, even more than erections, which, you know, it's hard to believe there's something more exciting than erections, but there is. Okay, take a look at this. Okay, arginine and citrulline are in macrophages, right? What are macrophages? Macrophages are white blood cells that we use to fight infection, right? And as it turns out, nitric oxide is used by macrophages in immunity. Macrophages use nitric oxide to kill bacteria and kill viruses. And there's a whole bunch of articles coming out now on COVID-19. Nitric oxide, now they're using inhaled nitric oxide, but that's just one way of getting nitric oxide into your body. But nitric oxide shows promise as an antiviral treatment. So until we're able to get enough vaccine out there to vaccinate our population, nitric oxide is a very promising antiviral treatment. It's got no side effects. And the way that it works, one, is to boost circulation. But two, macrophages use nitric oxide to kill bacteria and kill viruses. So I'm not a high-ranking politician in the United States that's going to tell you that Affirm cures COVID, but it's certainly worth taking a nitric oxide booster like Affirm to boost your nitric oxide to improve circulation. And it's clear, the scientific literature is very clear that macrophages and other white blood cells use nitric oxide to kill bacteria and to kill viruses. And so there you go. Erections and COVID. All right, so citrulline and arginine cycle. By the way, it's a little awkward because I don't, you know, when I try to make a little joke or something like that,
We're laughing.
I don't really like, you know, send a LOL or some indication that my pathetic efforts at humor are reaching the audience in some way.
No, you're
okay.
Anybody who's watching live, feel free to send some LOLs in, Dr.
Yeah, that's the one bummer about Zoom is you don't get any feedback. You just kind of hearing yourself drone on.
Well, you're doing.
Okay. All right, good. All right, so citrulline goes to the kidneys, and then there's an enzyme in the kidney that I'm not going to pronounce the name, but citrulline gets turned into arginine, okay? And then arginine, let's go over here, combines with oxygen in the endothelium, right? Remember, eNOS is endothelial nitric oxide synthase, and it kicks out a nitric oxide, and it gets recycled back to citrulline. And then citrulline goes back to the kidney, and then in the kidney, it's got that arginosuccinate, which converts it back to arginine, adds oxygen, nitric oxide. So it's this nitric oxide cycle of converting citrulline to arginine through the incorporation of oxygen. Okay, so nitrate, nitrite, and nitric oxide, okay? There are three different things. So what is nitrate? Nitrate is NO3 minus, okay? And it comes from food, it comes from beets, comes from kale, comes from green leafy vegetables. So they used to think, you know, spinach and kale and all those green leafy vegetables were good for you because they had antioxidants. But really, in reality, what it has is nitrate. Okay, but nitrate is NO3 minus. Okay, so how does NO3 minus get to NO? So NO3 minus is converted by bacteria in your mouth into NO2 minus. So here, nitrate and some nitrite from food. Okay, now you got NO2 minus Okay, and bacteria in the oral cavity reduce nitrate, NO3 minus, to nitrite, NO2 minus. The gastric acidity causes the reduction of nitrite to nitric oxide. So nitrate and nitrite are absorbed by the intestine. Nitrate is excreted by the kidneys, but nitrate and nitrite in the blood originate from food and from systemic nitric oxide production. So how to prevent blocking of nitric oxide production. So two things that your patients or you can do that will prevent nitric oxide production. One is antiseptic mouthwashes, right? Which is a little bit of a conundrum, right? Because if you have really bad breath, but a good erection, you're probably not going to use it. But if you have good breath and the opportunity to use an erection, you might not get an erection because you don't have enough nitric oxide. Now, fortunately, a nitric oxide booster like Affirm solves that problem because the citrulline goes straight into the stomach. But if, say, we didn't have something like Affirm and you had to rely entirely on eating beets and green leafy vegetables, then you would have to make a decision between good breath and good erections.
We have some laughs.
Oh, good. Yeah. All right. And the other thing is acid reducing medications, right? So if you affect the acidity of the stomach, then you're going to affect the ability of your body to reduce NO2 minus into NO. That make sense?
Yes.
So, all right, good. Now, this is kind of a confusing slide, but it's a really, really good slide. Somebody put a lot of time and effort into this slide. And so this really summarizes everything. So I'm going to spend a little time on this slide, which I found yesterday. So I haven't gone fully through it, but okay. So testosterone gives you sexual arousal, right? We all know testosterone boosts libido, which will then increase the parasympathetic signaling to the penis. Okay, and the parasympathetic signaling to the penis is nitric oxide. So there's an increase in nitric oxide release that does two things. It relaxes smooth muscle of the trabeculae, right? These sinusoids that fill up with blood. So the potential space opens up, and then it also relaxes the blood vessels. So it opens up the blood vessels. So that's how it increases blood flow. So if you just focused on the blood vessels, it would be more difficult. But by opening up these spaces, you're filling the penis, okay? So arterial dilation and expansion of sinusoidal spaces in the corpora cavernosa, right? Which results in increased arterial blood pressure and flow, which then occludes the venous return, right? So, this is non-erect. And so these spaces are filled with venous blood, and in the subtunical space, the vein is exiting. But now in a fully erect penis, the sinusoids are filled with blood and they're blocking the subtunical veins so that blood flow can't get out. And so I said, memorize that one slide at the beginning. This is the other slide to memorize. The difference when you go from here to here. This is the critical aspect of getting an erection, okay? Which results in decreased blood outflow, increased intracavernosal pressure, which results in increased penile rigidity, and then an erection. And so these are where the interventions occur. And so this intervention is oral PDE5 inhibitors. And, it's really sad that they don't recognize nitric oxide boosters. Clearly, there's overwhelming science that nitric oxide boosters participate in this equation. Here there's a PDE5 inhibitor but nitric oxide doesn't even get a little bubble, colored bubble. Okay, and then local vasoactive agents like alprostadil or papaverin participate. It works instead of the cyclic GMP system, it works through a different system called the cyclic AMP system. And then a vacuum constriction device will work with intracavernosal pressure, and then a penile implant will work with increased penile rigidity. Okay, so, all right, that's, I think, pretty much all I have to say about nitric oxide and how you get it from citrulline, how you get it from beets. Let's go into some of the other supplements out there, because I don't want to keep beating a drum over and over again. Okay, Tongkat Ali. Okay, this is comes from a bush in the Malaysian rainforest. The typical dose that's been studied on Tongkat Ali is 200 milligrams. And there is human data showing that there is a mild increase in testosterone, an increase in sex drive, and improved sperm quality. Now, a lot of this research is done in men with suppressed testosterone. There's not a lot of data on men with normal testosterone, right? And probably the reason for that is if you have normal testosterone, you're not going to go into a physician's office or participate in a study to boost your testosterone because your testosterone already is okay. So a lot of these supplements, the papers and the data come from men who have suppressed testosterone. And also, yeah, this has an anti-estrogenic effect, which is important, right? Because I should have put this slide in. Men are from Mars, right? And women are from Venus, but the difference between testosterone and estrogen is one single hydrogen molecule. So the smallest unit of matter with one electron, one neutron, and one proton is the entire difference between men and women. So it's easy for the body to aromatize or create an aromatic ring in testosterone to turn it into estradiol, into estrogen. So it's important that Tongkat Ali has an anti-estrogenic effect, kind of like DIM. A lot of us use a lot of testosterone replacement in our patients use DIM to block the conversion. Okay, maca. All right, maca grows as a root. It grows at higher elevations in Peru. As it turns out, a lot of the data on this comes from Peru, but Peru is, some of the papers have made some pretty outlandish claims. And I think it's probably because there's a vested interest for Peru and the scientists in Peru to prove that maca does something. The dose on maca is 1,500 milligrams, and the initial research probably out of Peru was promising, but the follow-up studies show that it does not influence hormones. Only half of the clinical studies been done show any efficacy, and it has not been shown to improve testosterone or estrogen. It does act as an aphrodisiac in men or women, but if I gave you a sugar pill, it might do the same thing. Now, what it does do is it increases sperm production. And so the testicle is 90% sperm production and 10% testosterone production. So if you increase sperm production, you're going to have an increase in testicular size. And if you have an increased testicular size, then you may have the false assumption that you're going to have more testosterone and you may feel more manly because your testicles feel bigger. But maca really hasn't panned out as to a supplement that's really worth anything. Okay, horny goatweed. All right, so the horny goatweed got its name not from some clever marketing guy, but from some fields where there was this plant growing, and they thought that the goats were acting more frisky when the epimedium was in the field. And it's thought to be an aphrodisiac and a testosterone booster. And the active ingredient is this thing called icarin, which is a flavonoid. Flavonoids are like the stuff that you get from colored fruits and vegetables. But in the studies, it has not been shown to increase testosterone, but it does have a slight effect on estrogen in postmenopausal women. So I'm sorry to disappoint these goats that they have to find something else to if they want to be horny. Okay, yohimbine. Yohimbine's been around forever, right? And it comes from the bark of a West African tree. But the studies show from the supplement, right? So there's pharmaceutical grade and then there's food grade. And so first of all, when you're buying supplements, make sure it's pharmaceutical grade, not food grade. That's really critically important and something that most people don't know about. But the yohimbine supplement has never been shown to influence testosterone, okay? Most of the data on yohimbine actually is on pharmaceutical grade yohimbine. Pharmaceutical grade yohimbine actually has an effect, but a fraction of the effect of a PDE5 inhibitor. So I don't know why you would ever take yohimbine when you could just pop a sildenafil or a tadalafil. But the pharmaceutical grade yohimbine actually has pretty severe side effects. So it gives people headache, sweating, nausea, dizziness, tremors, hypertension, tachycardia. So I would definitely stay away from the pharmaceutical grade yohimbine, and the supplement grade yohimbine. It's not worth anything. Okay, DHEA. All right, so here's like this ridiculous marketing. I don't know why these people used a picture of me on their marketing. I clearly never gave them permission to do that. But I mean, let's be honest, in the sexual medicine supplement space, people make ridiculous and outlandish claims and have pictures of like muscular men and hot women and, you know, draped all over each other. And that's what draws people's eyes. And that's what, you know, that's how people react and buy stuff. And so what I'm really trying to do is to not clean up the supplement industry, but just provide information to intelligent consumers who want to understand why things work. So, you know, and it probably comes from the area where I work. You know, in Northern California, within 40, 50 miles of my office, there's the headquarters of Google, Facebook, Apple, Oracle, Lawrence Livermore Labs. I mean, really highly intelligent, educated, you know, Workday. And so these people come in and I can't say, oh, look, you know, this DHEA's got really like a highly muscular guy on the front cover. It's got to work. That wouldn't fly with my patients. My patients, I call them why people because they're always asking why. You know, they'll come in with a stack of stuff from the internet, but I really welcome that because they come in with some really interesting stuff. And I've actually learned a lot from my patients. And if I haven't heard of what they brought in, you know, as soon as they leave or even sometimes in front of the patients, I'll get on the internet and search it up. Okay, but this is just an example of ridiculous marketing. DHEA. Okay, let me go to the next one. All right, so I don't know if you remember the steroid hormone pathway. The purpose of this is not to give you a biochemistry lecture because I'm not capable of doing that anyway. I got a C in biochemistry. I was really bad at it. But the steroid hormone pathway starts with cholesterol, and then it gets converted into pregnenolone, and then pregnenolone gets turned into eventually aldosterone and cortisol, so adrenocortical hormones, but then also into DHEA, dihydroepiandrosterone, which then eventually gets converted into testosterone, right? And then testosterone either gets converted into dihydrotestosterone, and DHT is what makes your prostate grow. It makes you lose hair. It gives you nose hair, ear hair, you know, all the wonderful men's secondary sex characteristics, or it gets converted into estradiol or estrogen, okay? So that's the purpose of DHEA is to, if your body doesn't have enough DHEA, it's not going to make a lot of testosterone. If your body has enough DHEA, then you'll just probably pee it out. And so a lot of the literature on DHEA is in postmenopausal women, where the testosterone will contribute to libido, and it's good for them to have a little bit of estrogen. The data on DHEA is a little bit all over the place, but in people that have baseline low testosterone, especially if you have a low DHEA level to begin with, it will boost testosterone in some studies between 10 and 15%. It really hasn't been studied in 20-year-olds, 25-year-olds. Okay. All right, ashwagandha. Let me move this. Okay. So ashwagandha, there is some data. Ashwagandha is a lot of Indian Ayurvedic doctors use a lot of ashwagandha, and there is some evidence that it has a mild increase in testosterone in men who are undergoing strength training or in men who have lower testosterone levels. Like I said, a lot of these have not been studied in men with basically normal testosterone. And I have another supplement called Support, which utilizes DHEA, DIM. DIM is a blocker, a natural blocker of the conversion of testosterone to estrogen, ashwagandha, Tongkat LE, and then magnesium and zinc. Okay, and we're setting up a study now to look at men. You know, the thing is, a guy comes into your office, and if his testosterone's 250 and he feels like crap, it's easy. You know, you replace it. And if his testosterone 700 or 600 or 550 or 500, you don't do anything. But what about the guy that's somewhere between 300 to 500 and he's doing okay? And maybe he's a little bit on the younger side, 50 or 55, and you don't want to put him on testosterone replacement, total testosterone replacement. What do you do? And so my solution is put him on something like Support, which is DHEA, which is shown to boost testosterone 10 or 15%, DIM, right? Because the knock on DHEA was that it blocked the conversion of T to estrogen. I mean, DHEA would make estrogen, right? You don't want to give a guy too much estrogen. So anyway, I kind of lost my train of thought, but something like Support is a good supplement to give someone who isn't either clinically hypogonadal or lab hypogonadal.
Quick question, Dr. Brandeis.
Yeah.
In the provider group, do you run testosterone testing for every patient you see?
Pretty much.
Okay.
Yeah, I mean, there's no reason not to. It's a simple lab test, but it gives you really good information. Okay, fenugreek doesn't work, right? So anyone that makes a big deal about having fenugreek in their supplement, doesn't work. Tribulus doesn't work. It's been tested. There's no significant influence on testosterone. I'm speeding up a little bit because I think it's getting a little bit late, and I want to leave a little time for questions. This is my favorite, Velvet Antler. Our supplement has Velvet Antler. So I don't know who's going to get the Velvet Antler. That's not a job that I would want to have, to try to pick the Velvet Antler off this was it 12-point buck. But repeated trials have failed to find an increase in testosterone associated with Velvet Antler supplementation. And so Firm Science, as you know, is my supplement company, and we make a nitric oxide booster. We make Support for testosterone boosting. We make Prelong for premature ejaculation. It's the only supplement out there specifically for premature ejaculation, and Spunk, which is for prostate health. So I think I left maybe 10 minutes for questions, but I can't see anyone with their hand raised, so I'm gonna need your help, Taylor.
I will forward you all of the questions, Dr. Brandeis. Before we get to the questions, can you tell us where to find more information on these awesome supplements, or where they can purchase?
Sure. If you just go to affirmscience.com, I have educational videos on each of these supplements and information on each of the ingredients in the supplements. And then actually, this is a QR code that we send to the offices that sell Affirm products. Will send you a nice display, hand carved.
Oh.
Yeah, a friend of ours is a master woodworker, and so she helped us out with this.
Awesome.
And she even has a laser engraving machine, and she engraves these QR codes that can actually work.
That is so cool.
Yeah.
All right, awesome. So I put the link in the comment section. Now onto our questions. Once you stop the nitric oxide boosters, are you going to go back to less improvements?
Yes, definitely.
Okay.
And, the thing is, I get all of my patients on nitric oxide boosters because it improves brain circulation. I mean, I just listened to a lecture the other day by Lou Ignaro, and he said the brain has the highest concentration of nitric oxide of any. Here, I'm going to get my notes. So I can be accurate. Okay. The brain depends heavily on nitric oxide. Nitric oxide promotes learning and memory in the brain. Brain has more nitric oxide than does the rest of the body, but we don't know why. Nitric oxide dilates blood vessels in the brain and promotes removal and washout of metabolites in the brain. Nitric oxide is an important signaling molecule in the brain. And then also, it's important to breathe through the nose and not through the mouth, because when you breathe through the nose, it's higher in nitric oxide because the nasal mucosa makes a lot of nitric oxide gas. So those are things that some of the things that I learned from listening to Dr. Ignaro the other day. I have
a feeling we just got a lot of people on the other end of this breathing through their nose. So
yeah, it's fascinating. I mean, like, who knew?
Okay, awesome. So on to our next question. Do you think sometimes it's a supplement that makes the real difference in the mind? Interested on your thoughts about this.
I think what you might be saying is there a sort of a placebo effect of taking the supplement? And what I would say is twofold. There's certainly, in sexual medicine, as we all know, there's a huge placebo effect of pretty much anything that you do. That when you flip someone from a sympathetic response to a parasympathetic response. But what I tell my patients, and I'm going to have a whole lecture coming out on this, is nighttime erections are really critically important for erectile health. And if you take, I'm 53, so I'm not a spring chicken anymore. And so if I don't take anything, there's a 50-50 chance I'll wake up in the morning with an erection. Okay. But if I take 2 Affirm pills, I wake up with an erection every morning. And when you're asleep, you get 30 to 60 minutes of erections every night when you're 20 years old. And if you want to maintain erectile function, there's a bunch of stuff that you need to do, including Gainswave, including, maybe penis pumps or whatever. But the simplest thing, especially if you're younger, especially if you're in your 40s, take 150 milligrams of citrulline before you go to sleep. You'll wake up in the morning with an erection. You'll feel good about yourself, and that shows that there's not just a psychological aspect, but there's a pure physiologic aspect of this as well.
Absolutely, as the research shows too.
And do that experiment on yourself. Record for a week how many times you wake up in the morning with an erection, and then take 150 milligrams of Affirm before you go to sleep and record how many times you wake up in the morning with an erection. And if it's 50% without it and 100% with it, First of all, that's the first sign that your erectile function is declining. And if you don't want it to decline further, then take 150 milligrams of citrulline before you go to sleep.
Mhm. Okay, next question. Does the dosage change according to body?
I'm sorry, what'd you say?
Sorry, does the dosage change according to body weight?
Yeah, that's a good question. I don't really quite know the answer to that. Intuitively, I would say yes. But I haven't seen any data or papers that that would support that. But you know, the maximum dose of citrulline is 10 grams. And so it'd be really, really hard to overdose. I have a video up on my YouTube channel where I take 10 affirms at one time, you know, on camera. And, you know, nothing happened to me except, you know, woke up the next morning with a really good erection. So it would be hard to overdose on watermelon, beets, ginseng, and Muir.
Okay, thank you. And then we're winding down on our time. So any last minute questions, please post them in the comment section. Can somebody wrote, I recommend your triple therapy, which is synergistic. Would you consider adding PRP or stem cells and then making it a quadruple therapy?
Absolutely. Well, the quadruple therapy for me is use of a vacuum erection device as a penile stretching, especially for men over the age of 70. So if you're not getting morning erections at all, then you need to be on a vacuum erection device. And so that's option number 4. And it's nice because it's inexpensive and it works really well. And there's a lot of really good data on using a vacuum erection device. But then number 5 is a PRP with or without. I use exosomes.
Okay, great. We're just seeing just some more comments, people saying that I take DHEA on a daily basis, people saying thank you. So if you have any other questions for Dr. Brandeis, feel free to comment them in the comment section and I will forward them to him. Otherwise, you can find supplements on affirmscience.com or within your Gainswave portal. And Dr. Brandeis, we really appreciate you being here for yet another fascinating talk.
A pleasure. Anytime, Taylor. It's, you know, we have a really nice community in the Gainswave community. And it's really nice to have physicians helping each other and supporting each other. I've watched a number of these journal clubs and everyone really takes it seriously. Everyone does a good job and everyone contributes the things that they know to help each other. And I think that's, you know, that's a great thing about being colleagues, about being physicians, about going through medical school and residency is that we know a lot of stuff and we like to teach each other and like to share it. And so, you know, it's my pleasure to help participate.
Thank you. We have one more question, but you're very right. It's a continuous learning community, and it's really cool how eager everybody is to continue that education. Somebody wants to know which exosome brand you use.
So I use Chimera, and so and honestly, I don't know a whole lot about all the different brands, but the nice thing about Chimera is that it's a cell line exosome. Right, so you can get exosomes from birth waste, so from cord blood, placenta, Morton's jelly, all that kind of stuff. And stem cells, as it turns out, you know, people have this romantic idea that stem cells engraft themselves into the host and grow, but that's not what happens. Stem cells don't last more than 1 or 2 generations, and then they create what's called a paracrine effect, right? So the growth hormones and cytokines that they secrete through their exosomes are what actually creates the effect. And so why bother taking cells when you can just take the exosome supernatant? And so that's why people use amnio, but amnio comes from someone, right? So it comes from birth waste. And so, but you don't know where that mother's been, and they're tested, but you know, testing's not perfect. And there are viruses that are out there that we don't know about, that we haven't tested for. And so why take a chance on amnio when there are cell lines that have been established before George Bush was president, and that's what we do research on for stem cells. And if you if you stimulate those cell lines, they can produce exosomes, and then you can just take that supernatant and then use those exosomes to boost your PRP.
Dr. Brandeis, I hope you don't mind. We just got 2 more last minute questions.
Sure.
Affirm. Does Affirm support maintaining an erection during sex?
Yeah, absolutely. You know, it's the signal plus the pipes. So Gainswave is going to improve the vascularity, right? But it doesn't do anything for the signal. And then opening up any blood vessel in the body is entirely dependent on nitric oxide, right? If you have no nitric oxide in the body, you'll never open up a blood vessel, right? And if you have tons of nitric oxide, then you're going to be much more efficient. So nitric oxide has been shown to decrease blood pressure naturally about 4 or 5 points, right? Because it makes the process of vasodilation much more efficient.
Okay, great. Thank you. And then this is our last question we'll be taking. Have you noticed a significant benefit of exosomes plus PRP versus PRP only for P shots? I
haven't done that study. You know, hopefully either myself or someone will take it upon themselves to do that study. But even I'm doing a study on PRP, specifically for penile elongation, but a secondary outcome from that will be erectile function. But the thing is, when you're looking in the population that I'm looking at, the erections are already pretty good. So you're not going to, it's not like the Gainswave studies where you go from a shim score of 12 to a shim score of 17. The guys that I'm looking at, they're already have a shim score of 23 or 24 or 25. And so it's hard to use any validated questionnaires to show an improvement in erectile function. You can show an increase in length, which is what we're going to do. And the other thing is that I have a double spin centrifuge now, and we draw 60 cc's instead of, I used to draw 22 cc's. So we draw 60 cc's, and then the double spin gets you about 3-fold increase in concentration over a single spin. Double spins are definitely more expensive, but I have a pure spin, double spin PRP situation, and the cloudiness of of what I'm injecting is dramatically different. And so I'm not promoting any one company over another, but I would definitely, if you're doing a lot of PRP, consider a double spin over a single spin. I've seen significantly better results with the double spin.
Thank you for elaborating on that. I believe that's all we have for today. www.affirmscience.com. Dr. Judson Brandeis, thank you so much.
Oh, you're welcome. And tell your patients to get their vaccines when it comes out.
Okay, will do.
So we can all get past this horrible chapter of our history.
Truly, truly. Have a great day, everyone.
All right, you too.